So I want to tell you the risks of anabolic steroids, also known as anabolic androgenic steroids. It's androgenic because it's most similar to the male hormone testosterone. And as you know, bolic means throw and ana means up. So it's like build up versus catabolic, which is throw down. So catabolic breaks down and anabolic builds up. So these are building steroids, anabolic. So build up steroids. And what is it going to build up? It's taken, anabolic steroids are taken as performance enhancing drugs for sports, and that's why they're banned, and that's why they screen athletes for performance enhancing anabolic steroid use. And so for neuro-ophthalmology, you're concerned about it in professional athletes, but also bodybuilders. And you're going to be especially worried about it in females because they're taking testosterone, which is the exact opposite hormone they're supposed to be on. And so they're trying to build up muscle mass, which it does do. Anabolic steroids do build up muscle mass. It caused all that controversy in the baseball steroid era for the home run race. However, it builds up other things too, and for neuro-ophthalmology, that's atherosclerosis. It causes lipid abnormalities and buildup of atherosclerosis. It can cause buildup of your heart muscle, but in a bad way. That's cardiomyopathy, and it can cause electrical abnormalities, most commonly arrhythmia, which means you're going to get stroke risk factors here. And it can affect your sugar and your hormones because it is a hormone. And so anabolic steroids aren't just about building up muscle. It builds up everywhere in your body and affects your kidney, your heart, your hormones, your glucose metabolism, and can cause hardening of the arteries. And therefore, in terms of a final common pathway for stroke, there's probably some genetic predisposition, but then you've got this multifactorial impact of anabolic steroids for a stroke, especially in a young person. So what you're looking for in stroke in a young is, of course, the regular stroke workup, MRI, MRA, CT, CTA, head and neck, looking for early atherosclerosis, looking for cardiomyopathy, atrial fibrillation, looking for abnormalities in the sugar, and then for males and females, the effects of the hormones, alopecia, hirsutism, amenorrhea, decreased libido, all from this androgen excess. And so the unifying mechanism for anabolic steroids is it's building up everywhere, and it can lead to a stroke, and that means it can cause homonymous hemianopsia, diplopia, and probably NAION. So the key and differentiating feature, you walk in the room and you see young muscular person with history of hormonal abnormalities, alopecia, libido change, amenorrhea, sugar abnormalities, cardiomyopathy, atrial fibrillation, accelerated atherosclerosis, and big muscles everywhere. You should be thinking in stroke in the young about exogenous anabolic androgenic steroid.